My name's Kathryn Nelson. I'm 24 years old and I'm in the community health education program. I went to the University of Minnesota for my undergraduate degree and I majored in global studies with an African influence and minored in journalism and Spanish. My primary background in journalism is African issues, refugee issues. I was working in conflict zones and war zones. I was telling stories about these terrible things that were happening. I one day picked up a boy who hadn't been fed in a month. I brought him to the hospital with the Red Cross and I watched him die. And after watching somebody die like that, I couldn't turn my back on the thousands of other boys and girls that were going through that same experience. I'm in the School of Public Health because I really feel like I can make a difference. What I'm being prepared for in community health education is going to prepare me for working with refugees and displaced people. I run an NGO called the Nifula Foundation, and it's a charity that helps vulnerable families and orphan children to build clinics, bring clean water to different areas, but specifically work in the public health arena. I created this foundation when I was 18 years old. I went to Kenya as an emergency services volunteer for the Kenyan Red Cross and saw that the people that were living in these refugee camps were actually, in a superficial sense, doing much better than the people that were living in rural areas. They were getting the public health attention, they were getting medical attention, they were getting food, shelter, and right next door, where there wasn't a conflict, people were suffering unimaginably. My job at the University of Minnesota is coordinating all the communications for a charity called Learning Dreams. It's run by an adjunct professor, Dr. Jerome Stein, and we work with families that have children that are struggling in school. It hasn't just been a job for me to make money and get through school. It's been an opportunity for me to foster my academic interests and to be supported by faculty at the University of Minnesota to pursue my dreams to be a public health officer. Part of the program for the School of Public Health is an opportunity to go out into the world and use your abilities and what you've learned to help other people in a public health capacity. I'm really looking forward to doing the field experience, whether it be back in Kenya or anywhere that I can take my skills that I've learned in the School of Public Health and implement them on the ground in Africa is exciting to me. What I want to do after I graduate from public health school is I want to work for the United Nations. I want to be a public health officer in Africa. And I would love to go into conflict zones and assess the public health situations in conflict zones such as refugee camps or conflict areas, war zones, and hopefully make some changes in the people's lives that are living in these conflict areas.